Good morning. Wow. Okay. I'm surprised I see myself here and I see other people. Okay. Good morning. My name is Mary North. I'm the current director of the Family Support Office at Nye House. Welcome to our first ever virtual Fridays at Nye House, hosted by the Family Support Office. I think probably either Jennifer, Suze, Lisa, or I have talked to many of you over the summer. I suspect that most of you have been to Nye House, either in person or online before. But for newcomers, let me tell you that at Nye House Education Center, our mission is to promote literacy for all learners by teaching teachers how to use the science of reading, by providing resources for parents of struggling readers, and providing direct instruction to adults who want to improve their reading and spelling. In addition to responding to calls and emails from parents, we organized several seminars during the school year. And this is our first parent seminar of the 2021 school year and our first ever webinar, of course. We hope you will join us for more virtual Fridays at Nye House seminars in September and October. We've also planned a college share program for high school students and their parents in October. The details are on our website, and you can be sure that you will receive a personal invitation soon. So today, we have Dr. Michelle Beard, who's a well-known psychologist in the Houston area who specializes in helping children. You may have attended her sessions at conferences like the one sponsored by the Houston branch of the International Dyslexia Association. We are so pleased that she is presenting our first fall virtual webinar ever in the whole wide world with the appropriate topic of managing stress and anxiety. Anxiety is almost the new normal, so it's more important than ever that we be aware of what is normal and what is not. It's a unique situation facing our children and all of us actually this fall as we are starting school, either in school or not in school, and virtual homeschools. This is going to, has already and will continue to cause us some stress and anxiety. Dr. Beard will discuss a background framework for understanding anxiety, ways to create stability, tools to manage anxiety and worry, and how to know when it's time to seek help. This program will be divided into two parts. After about the first 45 minutes, there'll be 15 minutes of questions and answers and a 15-minute break. Then we'll start part two, which will also be followed by a question and answer period. And actually, Dr. Beard has agreed to stick around for a while. So the Q&A is really an important part of what you're going to do today. We hope you will have questions, and they'll be submitted down in the Q&A field. The chat field is disengaged, but the Q&A field is engaged. So if you will put your questions in there at any time, and then we'll collect them and give them to Dr. Beard at the appropriate time so that she can answer them for you. And so it looks like that's good. I actually can't see if we have everybody logged in or not, but if we do, here we go. Good morning, Michelle. Thank you for being here.
Good morning, Mary. Thank you so much. I am delighted to be here this morning and to talk with all of you about anxiety and stress and a pandemic and some pandemonium that has gone on for all of us. You know, and I think part of my presentation is to help you guys differentiate between what's normal stress that we're all dealing with. A lot of people are feeling pretty overwhelmed. You know, we have to continue to be very resilient and flexible. You know, even in my own family, I have two children, and my older daughter is in elementary school, and her school told us, I think only about 9 or 10 days before school was slated to begin, you know, what our plan was going to be. And then about 48 hours before we were scheduled to actually return to school in person, they decided that we were all going to do virtual learning. And so even before my meeting this morning, I was getting her online in another room so that she can be participating in her school. And so, you know, I think for all of us, having to be flexible, having to roll with life in the moment has become very much the new normal, as well as coping tools that we've traditionally relied on in the past being inaccessible or having having to rely on them in a different way. We used to be able to see our friends in person. We used to be able to go and play on the playground and see people that way. Kids could go to school, and they were, as adults, we were able to go to the gym and social network and have some structure to our day. And that structure continues to change, and we continue to change with it. And so my hope today is that I can give you guys a little bit of information about what we know about stress in the pandemic and what we know about stress in general, and some tools that I hope will help you along the way. So I'm going to go ahead and share my slides for you all, and we're going to start there. They are also available. The slides are available online. You should have gotten a link to them when you entered the webinar, and if not, they will be available via a link afterwards. And so we are going to go ahead and start here. So as I mentioned before, my presentation is titled Pandemonium and a Pandemic: How to Help Yourself if you're a parent and your child cope with stress and anxiety. So what do we know about stress in the pandemic? There have actually been a number of news articles written, from the Wall Street Journal to Time Magazine. When I was in CVS the other day, it had all of these different faces, and it was another article about anxiety. It was the cover story. Many people are stressed as it relates to the pandemic. And then obviously a number of people, unemployment rates were so high when the country was closed. And we know that that's a source of stress that we'll talk about a little while later. So what do we know from some of the news articles and early research about what people are looking like, how children are responding to the pandemic? So there's a reversion to younger behavior. And this goes back to a time when maybe you felt more stable, a time when life was simpler, and a craving to return to that. And so sometimes you'll see in younger children, like elementary age children, who stop sucking their thumb. They may go back to doing that because that's a self-soothing mechanism. We actually know that thumb sucking and blanket rubbing and having your stuffed animal, those are all different ways that people self-soothe. And so thumb sucking is one of them that may return in your child. And I would say, with the stress in the pandemic, I wouldn't overreact to that if that is a coping tool that a child has gone back to. Toileting accidents in general are usually, once children have gone through the toilet training process, when accidents are happening, they certainly can be related to a biological concern, like an infection, but also can be related to stress. And so especially nighttime accidents or even accidents during the day can be related to stress. And so just being aware of that, talking with your pediatrician if that's something that your child has going on, to be sure that you're ruling out any sort of physical physical concerns, but then, recognizing that can be an indicator for you of stress. Clinging to parents. So, let's say that you used to be able to go out and walk around your block, and your late elementary school or middle school children were just fine with that. But now you can't, or you used to be able to go in the backyard and to tend to your garden, and now your children want to know where you are all of the time. Again, as life becomes more or less and less certain for kids, they don't know what to expect. And so they rely on the things that they know, and knowing where their parents are is one of the more stable factors. In addition, a lot of families have been spending a lot more time together. And so children are much more used to checking on where their parents are, knowing where they are, and then having to go through that separation process again as parents begin to be out of the home more, to do more independent activities. And then less independence to accomplish tasks. There was a lot written in literature about people who used to be able to brush their teeth, and now they need their parents to stand up upstairs with them and brush their teeth, or they needed some help to, tuck themselves into bed, or with bathing time. And again, I think there's just this craving for being with parents. And as we talk about later on, as one of the documented coping tools for anxiety, when children actually have anxiety disorders, we oftentimes will encourage something called you and me alone time, or gamma time. We know that bonding time with parents is so important. And so, sometimes children will seek that in positive ways. And then when we are not paying attention, or we just get busy with life, sometimes children will pull for that attention in other ways. And sometimes that's what we, as psychologists, sometimes call negative behavior. So like acting out, but other times it may just be this regression towards less independence of tasks, just needing more parent time, because parents parents are a great way that children are able to feel calm and secure in the world. And so, you know, I think it's fine to draw boundaries though. I mean, you don't necessarily need to be brushing your teeth, but I wouldn't respond in frustration or anger. I would just be encouraging and say, oh, you can do this, but you may need to slowly phase yourself out of being in the bathroom or something like that, but trying to limit your own frustration in response to these kinds of behaviors. That there's nothing wrong per se with your child. It may be just their reaction to stress. And so you want to be as compassionate as you can in dealing with them. So as you see, we have a very unhappy toddler there. So there can be changes in mood. You know, one of the saddest things I read about the other day, there was an article, I believe it was on Apple News, and it had a picture of a little boy, and he was sitting there and he had started his distance learning class, and he was crying with his teacher because he was so frustrated. And, you know, we have learned a lot about Zoom fatigue. Adults are experiencing it. Certainly children are experiencing it. And unfortunately, distance learning requires a lot of computer time, you know, time listening to webinars, time on virtual learning. And so that is producing a number of emotional responses in children, especially in our elementary age and younger children. You know, it's surprising how many hours young kids are having to sit in front of the computer. But in the same sense, parents also have jobs, and so they necessarily can't be their own teacher as well. So what do we see in children like this little boy in Apple News the other day? He was crying. He was sitting there crying, and you know, his teacher was recognizing how frustrated he was. So kids can become irritable. They can be angry. They can be frustrated. They may seem more moody than they were before. You may see more temper tantrums, maybe temper tantrums in children that didn't used to have them, and maybe just an exacerbation or more tantrums than children used to have in the past, as well as heightened anxiety. So they're seeming more nervous. And again, you know, there are reasons to be anxious. We all have to live a little bit differently. People are using hand sanitizer all the time, and you have to be careful of what you touch and where you go, and wearing masks. And, you know, these things communicate to kids that life is different. And so we're all having to respond in a different way and learn to tolerate these differences in our environment that we're not used to. Increased headaches and stomach aches. This has long been a common symptom of children who have anxiety disorders. Oftentimes they're unexplained, so they're not related to allergies or not eating. Some children have gone through a variety of tests for their headaches or stomach aches, and they end up being stress related. Again, I always encourage people to talk to their pediatricians about headaches and stomach aches that kids may be experiencing, especially if they're chronic. You know, a headache or stomach ache here and there is part of childhood, but something that's happening on a weekly basis or multiple times a week definitely needs to be investigated with your pediatrician, but is also a common sign of stress. And so sometimes, which we'll talk about later, stress is experienced in worries. I'm so worried, please don't leave. Sometimes it's experienced in physical complaints like headaches and stomach aches. So we may not even recognize I'm really stressed, but this may be something that's coming out in the headaches or stomach aches, and that may be our first indicator that our child is stressed, not necessarily that they're telling us that they're worried or stressed. Historically, in anxiety disorders in general, but also even in the pandemic, I've talked to different families who have said, you know, my child was always a great sleeper and now they're having sleeping problems. And, you know, especially with the advent of school coming very soon or already starting for some people, that, you know, it is very hard for kids to fall asleep. Sleep tends to be that resting time right before sleep, a time when our mind is supposedly empty. But for my anxious or worrisome kids, they begin to think about all the things that are to come, all the what ifs of the world. You know, I like to think about what ifs kind of like a little hamster on his wheel. And so I call it the worry wheel. So he climbs on the wheel and he starts spinning very, very quickly. And out of the wheel come all of these like cartoon thought bubbles. What if this, what if that, what if this, what if that? And the faster the hamster spins, more what ifs come out of his wheel. And then it's enough to fill up your whole brain. And then, you know, it makes it very hard to go to sleep when you're thinking of all of the what ifs. And so, you know, it's coming up with a quiet bedtime routine. It's coming up with other things to think about that occupy your mind that are calming. Because for some kids, they let their mind wander and it takes them to these worrisome places. But if there are changes in your child's sleep, that's an indicator of stress. If they are waking up in the middle of the night, they don't want to sleep in their room anymore. That's been something that's been common as well in the pandemic. as well as just trouble falling asleep. Changes in eating, that can be overeating or undereating, becoming increasingly picky about foods, and they historically have not been. That's an indicator of stress. And then isolation. I would say that isolation, it can happen more in younger children, but we tend to see this more in teenagers, especially if they get very sad or depressed. And, I think that isolation, some parents would say, well, my child lives in their room all the time anyway as a teenager. What's different about that? But again, as a parent, qualitatively, if the isolation seems more extreme. They seem to be talking less to their friends on FaceTime. They seem to, have a sadder affect or facial expression more of the time, or be more irritable, quite frankly. But those are just signs to watch for changes to the sleeping, eating, and isolation in your children. It's very interesting. We don't have a lot of what I would call hardcore scientific data. I think a lot of people are gathering what we call anecdotal data, which is asking people how they're responding and sort of polling them. But we do have some science out of some scientific studies out of China, which is not surprising because the pandemic began there. And so there's just been more time since the pandemic began to poll and analyze scientific data. So the Journal of American Academy of Pediatrics, and so found that 23% of students in Hawaii were suffering from depressive symptoms, and 19% reported anxiety after being at home for 2 months. Now, we're going to get to some statistics about anxiety disorders in general in the United States, not in China. The research that I have is more about the United States. But anxiety disorders actually are known to affect up to about 20% of the population in some places. Now, I will say historically in places like China, there may be less reporting of some of that. And so it may be that these rates would be especially high. But nonetheless, to have 23% of students suffering from depression is a very staggering number, and more than we would expect. And many people, as I have spoken to patients over the last few months since the pandemic began, have reported increasing depressive symptoms, trouble with motivation, trouble with, seeing, kind of what's gonna help me to get through the day, because every day seems to blend together. I was reading some cartoons about the pandemic, and it was talking about what day is today. Tomorrow is Saturday, right? And the parents said, no, it's Tuesday. We don't really know what day it is, because everything blends together. We used to have the structure of what we do during the week and what we do during the weekends, and what we do on Mondays versus what we do on Thursdays. And everything is just about, I don't want to say the same, but we have distance learning, and that blends over. And if you don't finish your distance learning, then you're doing that on the weekend. And and we don't have the scheduled sports activities, we don't have the social events, we don't have the calendars that we used to have to help differentiate, and people don't have their coping tools as much as they used to. And so absolutely fueling a sense of depression for them. One of the things, we talked about regression earlier to a younger version, children to a younger version of themselves. And, one of the things that's being posited or thought about for the pandemic is that this may cause some sort of arrested development for kids, that in essence, we're putting the pause button on a number of really important life tasks that, in certain ages, in elementary school, in preschool, in your middle school and high school, you're laying foundational skills that we build upon in the future. And so, being with other people, having social interaction, not just over Zoom, sadly, or FaceTime, or, your video game, is very different than having a one-on-one interaction. And it was so interesting, before I had my own children, I read a fascinating book about babies and learning language with infants. And part of it was done, the study was done in a number of countries, because they were trying to replicate it. And so they found that babies attenuate to certain sounds. So there are different sounds in Mandarin versus in English, for example. And so babies will attenuate to those sounds when they're very young. And if you haven't been exposed to that, it's not that you can't learn language when you're older, but your brain is attenuated to, let's say, both English and Mandarin if you were exposed to both of them, as opposed to just English or just Mandarin. It makes it a little bit harder. And I think that's probably part of why it's more difficult to learn a foreign language when you get older. But babies attenuate to the sounds of the language that they were were raised in. But they did a trial about learning for babies, not for elementary and older children, but they did a trial about learning for babies, and they had giant television screens, and they had the same graduate students who taught the babies about language skills and in person, and they had the same students who taught them on these giant screens, and they put them on the floor so the babies could interact one-on-one with them. And the babies who had the computer screen didn't learn the way that the babies who had the face-to-face interaction did. And, you know, obviously I'm not going to say that distance learning doesn't work. And I think the older that you get, the more amenable it is and the more related it is to your brain. But we still know that social interaction is so important. And even though my teenagers are perfectly capable, I think, of digesting quite a bit of the material in virtual learning, they so miss their friends. And so, you know, recognizing again as parents, having compassion for your children that they are struggling because a part of their learning and development is missing right now. For preschoolers, you know, they're learning really essential skills about how to control yourself and your emotions in a group situation, and that you can't always just get what you want. You have to learn to cooperate and to share, and you can't do that very well over Zoom because you still get to keep your Legos and they get to keep their Legos. And you don't have to negotiate in the same way as you would with a child trying to pull your toy away. And how are you going to deal with that? You know, in terms of elementary school age children, you get to focus on taking another person's perspective. How does somebody else feel? You know, on the playground, if somebody falls and skins their knee, it's having empathy for them. It's taking perspective when someone says that you hurt their feelings and you don't really understand why. How to handle winning and losing, not getting to play your game at recess. Everybody wants to play soccer and you want to play football. How do you handle that? Dealing with conflict. So those conflict negotiation skills don't just happen when we're adults. The foundation for them is laid when we're children, and learning how to tolerate, you know, getting along with others and making compromise. And then by the teenage years, interestingly enough, we're laying the foundation for long-term, you know, relationships, those deeper relationships that we have with friends, using social support as a coping tool. So, oh my goodness, you'll never believe what my teacher told me to do today, or what we had to learn today. I was so confused. And we still are seeing children do that and teenagers do that via social media, but it's just different. And a lot of people are tapped out with a screen. Some people want to talk, but other people just want to have some alone time. And so then they're not able to have that interaction that they would be able to seek, you know, one-on-one. One of my students yesterday was talking to me about going back to school, and they are going to go back to school, I believe, in a few weeks, but they were really struggling because they all have to stay 6 feet away from each other. It's very hard to have a personal conversation with someone about anything other than, I don't want to say the weather or your math assignment, 6 feet away from anyone else, you know? And so then we're back to, even when we're in person, we're not allowed to have that social support network of really sharing and supporting each other, because we're not able to do that unless we broadcast it kind of to the world. It's also important to talk about loyalty, you know, and negotiating challenges. And doing that face-to-face, setting boundaries with people. And so when people are invading your personal space, you know, too much sharing or too little sharing of information, these are all tasks of adolescents that are being muted in some ways by this pandemic. So other concerns about arrested development that we are seeing, you know, socially anxious children, some of them are delighted that they have homeschool because they don't really want to participate in class. They don't really want to have to even go to school. They're very happy to stay home with their parents. And if they have 30 kids in their class via Zoom, this is awesome because they may not have to say very much. Or if they do, they are just a tiny little box on the screen. Now, some children may also be struggling because they felt kind of out of control before the pandemic. And so they may be kind of going backwards in their skills. But my socially anxious kids, while it may seem like a huge relief to them, you know, when we talk about anxiety, I often will say a lot of people who come into my office have two coping tools that are their primary way of dealing with life. And that is, they are escape and avoidance, or kind of the tools in their tool belt. So escape is, if I go to school and I feel really uncomfortable, then I get a stomach ache and I have the nurse call my mom and I get to go home. So that's escaping. And then avoidance is, I just don't want to go to school at all. And so, you know, for my socially anxious kids, where they're not feeling like they have to go and participate and be around people to the same degree that they did before, it's almost like permission to have avoidance, which is a relief to them in the moment and right now during distance learning, but may make going back to traditional school in the future much more difficult for them because they've kind of not used those skills. And one of the things that we know about anxiety management is you have to use your skills. And over the years as I have had patients struggle with bursts of anxiety, that I will joke if they've come in for what I call a tune-up, they've been doing really well at managing their anxiety and go through a wave where it has gotten high again. I will say we need to go out in the tool shed and find your tools. I think some of them have gotten hidden and some of them maybe, excuse me, rusty. We need to go out and get those tools and use them. And, and so for a lot of my socially anxious kids, they have not been having to use their tools. They've not been having to face talking to other kids. They've gotten a lot of avoidance. They've just been at home with their family and they feel very comfortable with them. And so it's having to get out those tools and practice, so practice sending emails, practice talking to people that you're not familiar with, wherever the opportunities present themselves to help your children to be ready for when they have to go back and to do that in the classroom. And even via Zoom, setting goals with your children about making comments to participate, or even emailing their teacher or setting up office hours and asking questions, just to continue to build those skills so they don't become so much of an issue when children return. I found this to be very interesting in one of the articles that I was reading, and it makes a lot of sense when we think about what we know about parent stress and how that links to child stress in the family. So previous studies have looked at unemployment rates in parents, and remembering that unemployment rates skyrocketed in the United States during the pandemic and the shutdown because a lot of people are hourly workers and lost their jobs. A number of people just weren't able to work. If you work in the mall or if you work in a food service industry, a lot of people were just not able to be working. Many facilities were closed for months. And even in some places of the countries, still continuing to reopen. And so even unemployment rates as high as 5% or a 5% increase in unemployment can have a dramatic effect on children's mental health. And part of that is about resources, part of that resources of parents to provide that, but part of it is also about parent stress. So we do know that children are incredibly savvy at reading our stress as parents, and they tend to take on our stress. And so as best as we try to hide it, oftentimes kids will be aware that something is wrong. And if they don't know what it is, then sometimes they worry all the more about what is going on and what is going to happen to them. And so, helping your children by managing your own stress, doing whatever you can to create certainty for yourself, to find positive well-being in your own life, to find coping tools. So going out and exercising, taking a few minutes for yourself, being sure that your gas tank isn't completely depleted of kind of cognitive, mental, emotional energies is really important for your kids. But then also being honest with them. It's okay to say that you don't know and that you're figuring out together. But also highlighting that there have been a lot of people in history that have not known, and somehow, some way, that's what resilience is all about. We get through it, and then we come to the other side, and hopefully we've become stronger. We've learned some lessons that have turned us into people for the better as opposed to for the worse. But certainly that's a choice that we all have to make. Changes to the family unit during the pandemic. So for example, if parents get divorced or separated during the pandemic, there's been a lot of togetherness, and I joke it's too much togetherness for some people that, where they've gotten on each other's nerves. And I have tried to encourage families, don't be overly concerned that your children are not getting along as well as they used to. Don't be overly concerned that, you're feeling more stressed with your children. I mean, even I think it was Dole Fruit commercial I saw the other day was talking about using, words about fruit pockets when people got, or fruit packets or fruit bowls when they got stressed. And so, even family dynamics and makers of fruit are commenting upon what's happening and the stress that families are feeling due to the pandemic. This was also really interesting. Some of the research notes that between 35 and 57% of children's mental health services occur at school. So the school counselors, if you have not thanked your school counselor lately, whenever you get to see them either in person or virtually, be sure to give them elbow bump or a hi and a thanks, because if you think about that, that's a huge amount of services for your child that are being provided at school to help them to cope with life. Now, the unfortunate thing about the pandemic is a lot of children are not receiving those. It will be interesting to see this fall. A lot of schools, as the whole world was caught off guard by the pandemic, and people were doing the best that they could. But, some students were beginning to receive their dyslexia intervention services online last semester, but more and more students are, going to have access to different services in a variety of ways this year. And so, working with the school counselor and trying to advocate if your child needs some help, what's available to them, and finding resources to help your children. So anxiety disorders versus pandemic stress. I mentioned earlier that around 20% of the population has anxiety, and the numbers vary greatly from one group to the next and from one study to the next. So the National Institutes of Mental Health would say that somewhere between around 25% of teens between 13 and 18 will suffer from some form of anxiety during adolescence. Obviously there are lots of issues that happen in adolescence, from body image to social drama, to just worries about college and perfectionism. There are many things, unfortunately, to be stressed about as a teenager today, but nearly 6% of those children will be considered severe. And so a pretty serious anxiety disorder that definitely needs assistance from a mental health professional. As a result, anxiety disorders actually are one of the most common mental illnesses among adolescents, and anxiety actually represents one of the most common health problems as well. Nearly 40 million people, or 18% of children, adolescents, and adults, suffer from an anxiety disorder, according to the Anxiety and Depression Association of America. And they also talk about that children with anxiety disorders are, more likely to have problems. So, if you're stressed, are you going to be able to sit in your class and fully think about what's going on in your classroom? No, you're getting stressed and you're thinking about all of those worries, and then you've missed out on algebra, and then you're stressed out because you missed out on algebra and you don't know what's going on, and then how are you going to do your homework? And it kind of spirals out of control. And so sometimes kids who have anxiety do struggle academically because of those challenges of getting distracted. And that's not an ADHD distraction, that's a distraction about worries and what's going on in your brain. Unfortunately, children with anxiety disorders are also prone to increased substance use. We call that self-medicating. So certainly if you are a teenager and watching this, or a child, or of someone looking at your own child, being sure to get them the appropriate help from their school counselor, from an outside professional, talking to their pediatrician, to be sure that they're not trying to engage in self-medicating to help themselves feel better. And then disturbances in social functioning. We talked a little bit about my socially anxious kids earlier, and how they would be just as happy to be at home and to, avoid school with the social interaction. It's usually not the academics that bothers them, it's the social part of it that's so hard for them. All right, so where does anxiety come from? I have my little picture up there that says it's in the genes. So anxiety comes from a combination, actually, of genes and environment. So we do know that if you have family members who are very anxious or nervous or worried about lots of things, then you are more likely to develop an anxiety disorder than someone who does not have a family history of that. And typically it runs down the line of, having grandparents or parents or aunts and uncles that share anxiety. Oftentimes we have multiple people in a family that report suffering from anxiety. And, the interesting thing though is that it's not what we call a one-to-one correspondence. So if your mother, for example, has obsessive compulsive disorder, where she worries about germs, which we can come back to in a minute, worries about germs, and then has a variety of rituals that she has to go through in order to keep the environment at home and herself safe from these germs, it doesn't necessarily mean that that her child is, if they're prone to anxiety, would necessarily develop obsessive compulsive disorder. They might, and part of that is, which we'll get to on the next slide, about social learning. But it's more just a disposition towards anxiety. So the child could end up with panic, the child could end up with generalized anxiety. It could be a variety of different issues that could happen for that particular child. And then, sometimes we talk about the meeting of genes plus the environment. Sometimes there is a huge stressor, like a pandemic, that would trigger an anxiety disorder in a child who was already anxiously predisposed. But for other people, it's very interesting. You know, the stress and coping literature for years has highlighted that it's not so much a large stressor that seems to be the most profoundly impactful, but it's actually the accumulation of lots and lots of little stressors. And so that those actually can build up over time to be even more impactful than a large stressor. You know, I will have some parents who will come in and say, oh, you know, like I have anxiety, but I was raised in a really difficult family situation, and I certainly understand why that would trigger my anxiety, but I've tried so hard to make my children feel so confident and to be so kind and compassionate and really do the opposite of my parents, and I don't understand how my children are still anxious. I mean, you know, they've never had anything traumatic happen to them. How can this be? And, you know, therefore I need to talk to them about smaller stressors that have likely happened, and that, you know, it wasn't some catastrophic event that occurred for this particular child, but it was just the slow or even small triggers. And some of them can be triggered by hormones. You know, that's something that often doesn't get a lot of discussion in public, but certainly is dealt with in the literature. OBGYNs and pediatricians are aware, you know, that after, for example, women have children, they're not only prone to postpartum depression, but they're actually prone to postpartum anxiety. That the hormones tend to trigger anxiety. That's also true to a certain extent for, you know, children going into puberty and teenage years. We see much more emotionality. Sometimes you can see anxiety, you know, related to the hormone component as well. And so, you know, being aware that there's a lot going on. And so it may not be a particular event like a pandemic that triggers anxiety, though in this particular day and age, it very well could be. You know, and I think for a lot of kids with the pandemic, you know, children have questions about going back to school. Am I safe to wear a mask? Am I safe to, you know, am I going to get the coronavirus? What's going to happen to me? And I think, you know, trying to talk to them about what they can do, what's in their control, how can they try to keep themselves safe? You know, we can't talk about things that we have no power over. We don't know when there'll be a vaccine. We don't know how well a vaccine will work. You know, you can talk about that those things are being worked on and developed, but right now, what do we know we can do? You can try to stay 6 feet away from people. You can put on your mask. You can wash your hands regularly. You can be sure your mask doesn't fall down below your nose. I actually saw a newscast yesterday, and I have joked, I've seen children in my office individually for assessments for a number of months since May. But I joke about, and it's just me, I'm the only person in my office and I wear my mask the whole time, but you know, children's mask wearing is quite variable. Some children wear their masks quite well and diligently, and other children have the mask below their nose, you know, on a regular basis, and you know, need reminders to bring it up. But part of it is that children have complained about having trouble breathing. You know, some children will take off their mask and start to spin it around, and you have to redirect them to put it back on. So, you know, part of, I think, helping your children go back to school, if they are going to be going back to school in person, is talking about how to wear your mask. And what does that look like? And, you know, that we really can't be swinging it around. What are some other things that we can be doing to fidget with besides, you know, your mask, because that's not the best thing to be taking off, and that we need to wear our mask. This is how you wear your mask. But then, you know, there was actually a lot of wisdom. One of my daughters, her school personnel asked parents to start to have children wear their masks at home to build up tolerance. And as a professional, I will say, because I have been seeing these students, I've kept most of my anxiety patients and parent interviews and things virtual during the pandemic, and still since it's ongoing, but I have been seeing these children in my office, 1 or 2 children a week. And, you know, I think that I noticed originally when I was doing testing that breathing through a mask was challenging, and that I felt a bit oxygen deprived for the first month or 2 of wearing the mask. But then now it doesn't really bother me. It would bother me, I think, if I had to wear it 8 or 9 hours a day, but just because I'm not as used to it, versus now you ordinarily don't have to wear it more than 4 consecutive hours, and then we'll be able to take a little break. But you know, it's helping your children, because if they're going to be at school for 8 or 9 hours a day, how are they going to handle that? And some children have extreme reactions. I've had one child get very nauseous, and my office mate actually says that she will continue to see people virtually as long as she has to wear a mask, because she will get nauseous when she wears a mask. And so helping your children, I mean, that's really scary if you send them to school and they feel like they can't breathe and they feel like they're going to be nauseous. So definitely, please be helping to set your children up for success by having them wear their masks at home for periods of time. time so that they can work up to at least one time where they've worn the mask in your house for 8 or 9 hours, however long they'll be at school, at least one day. And I would recommend for, a few days here and there so that they can process whatever strange feelings or sensations they have, and to help build up, and your body does acclimate to it. And to helping to normalize that for your children, and that it will go away for at least most of them. And if you're having trouble, again, going and talking with your pediatrician about the challenges that you're having, but all the better to do that at home with you than to have to do that at school, and to be surprised about what's happening, and to be scared. And so I think that it's really important to try to process that mask wearing with your children. All right, so where else does anxiety come from? Sorry for my tangent, but I'm going to try to add in little tidbits as I think of them and as we go. So anxiety, as we talked about before, comes from the genes, but it also comes from environment. So it could be a traumatic event like a pandemic. So as I mentioned about the OCD mom and her fear of germs, and that there could be what we call vicarious learning, or learning from another person. And so, I remember years ago, I worked with an OCD patient, and their parent was very concerned about the fact that when they touched the doorknobs, they could get the flu. Now, this was before a pandemic was happening. And so, what I told my client is I said, okay, here's the thing. You have pretty bad OCD. You deal with this every day. You've dealt with this every day for many years. And I need you to be able to touch doorknobs and to do some of what we call exposure therapy, which is facing your fears, doing the things that you're afraid of, and then holding off. Again, I'm not going to ask them to touch doorknobs and germy surfaces and then go and touch lots of food. I mean, all of us would go and wash our hands first. So, but we would need to touch the doorknobs and then go about some of our life, and then wash our hands before we ate again, or wash our hands when we went to the bathroom. And so it's trying to delay those kinds of behaviors. So, so I talked with this patient about the fact that, their parent was very concerned about touching doorknobs and how they were going to get the flu. But yet I said, the flu, if you got the flu, which I don't want you to, but if you got the flu, it would happen to you for a few days, and you're very healthy, that your doctor does not feel like you're at risk, that something terrible is going to happen if you have the flu, but you can have the flu, and, worst case scenario, you get the flu from touching doorknobs, and you have to deal with that for a few days, but you have to deal with OCD for like all of your life, every day. And so if we have to do some exposures, then we may need to touch the doorknobs and learn that it will be okay. And that only that affects you 365 days a year, versus the flu might affect you between, 2 and 10 days of the year. So, but part of dismantling and helping my client to engage in this exposure was helping her to recognize that part of her learning that this was dangerous was because the message her father continually sent to her. And so, so we do learn to be afraid. And again, I think this is a fine line. I mean, obviously in a pandemic, I have hand sanitizer in my purse. I'm squirting my kids' hands all the time, not just right before we eat, but when we go in and out of the car, anytime that we go anywhere. And so again, I think that the pandemic has blurred some of our lines about, what is and is not acceptable in terms of an anxiety. I mean, people are naturally anxious about getting a pandemic, and we don't really understand all the things about how it works, and we need to take extra measures to keep ourselves safe. And so that's very different than something that is much more well known. But we can learn about being anxious. Now, I will say one of the few anxiety correspondence that we do know tracks from parent to child is social anxiety. And in part, and that really has a strong component of vicarious learning. And oftentimes people who are socially anxious are not taking their children out in social situations. They're not communicating with other people socially. And so they are kind of shaping their children's social interactions based on their own. And we are models for our children, models of how we handle stress, models of how we interact with the world. And so if you interact with the world in a very reserved and isolating kind of way, then it's very likely that your children will learn those same kinds of patterns. We also learn from what others tell us, so if people tell us that things are dangerous, if people tell us that bad things will happen to us if we don't get an A on our grade, then that can certainly make us afraid, and we can learn some anxiety that way. Or if somebody else has experienced a traumatic event, sometimes we will learn. Now, there are a variety of different kinds of anxiety disorders. The first two are adjustment disorders. I would say that adjustment disorders are things like a pandemic, for example. If your child has never suffered from anxiety before, but seems to be having a burst of anxiety that's been bothering them for a couple of months now, is affecting their sleep, is seeming out of control, then an adjustment disorder diagnosis, either with anxiety or what we call with mixed anxiety and depressed mood, which is where they also have the sadness or the irritability that goes along with it. You know, that those are diagnoses that we give in adjustment, well, in relation to life stress. So when life is hard, if your parents got divorced, if you went through Hurricane Harvey, if you had to go through the pandemic and your life felt very uprooted and chaotic, these are things that would trigger, you know, anxiety, and we would call them an adjustment disorder because you're just responding to the stress in your environment. And that tends to be something that would come and go, that when the stress is over, that we wouldn't necessarily expect you to be struggling with anxiety anymore. Now, generalizing, the rest of them are what we would consider more classic anxiety disorders and things that are, again, more that genetic predisposition plus some environmental factors, and they're likely to be things that ebb and flow over time. So generalized anxiety disorder is anxiety about the world in general. It could be some perfectionism. It can be worries about everything from burglars to the dark to, you know, what do people think of me? How am I going to do next week on this test? So some performance anxiety as well. Social phobia or social anxiety disorder is that you get very worried about what other people are thinking about you. And that's kind of the obsessional focus, where you feel very uncomfortable around people. Obsessive compulsive disorder, you have a thought, you know, the classic one is about germs, but it can be a variety of things. And then you have various rituals that you have to go through in order to try to eliminate or to decrease the stress. But unfortunately, the more you ritualize, the more the cycle tightens. And so the whole goal is to begin to break that pattern. A specific phobia, this is very common, especially in young children, but even into adulthood. You know, blood injection phobia is very common. People who freak out when they have to have needles or go to the dentist and have a procedure, but otherwise don't seem to have a lot of anxiety. You can also have multiple anxiety disorders. So you could have a specific phobia plus a generalized anxiety disorder, for example. Panic disorder. So panic disorder is about physical symptoms. So when you get anxious, it primarily manifests in your body. So you start hyperventilating, you start shaking, you start freaking out, and you know, it's that hyperventilating and feeling out of control. Some people will feel very dizzy, feel kind of weighted down in their body and unable to move. And so helping them to learn tools to manage that panic. Post-traumatic stress disorder, this is where you've been through a true traumatic event and children might have flashbacks about the event and remain very scared of this occurring with them again. Selective mutism. Selective mutism is something, despite its name, it's not selective. Your child doesn't just wake up one day and decide, oh, you know, I don't want to speak to this person. Traditionally, it's a disorder that's highly related to social phobia or social anxiety disorder. A lot of children who have selective mutism, which typically manifests in the preschool and very early elementary years, and then oftentimes turns into a social phobia or social anxiety disorder. And selective mutism is where children are able to speak quite normally with their family or certain members, you know, that they're very close to. So they can talk to mom normally at home, they're laughing and communicating with siblings, but when they go out, even in their yard, they can't talk to their neighbor. They oftentimes won't even exhibit eye contact or nonverbal signals. And so you're slowly working with them to engage. And certainly they have a lot of problems usually at school. Sometimes some of them will communicate with other children, but sometimes they won't communicate with anyone. Not teachers, not children. They're just completely almost like they're mute. But they're not. They're able to, it's not a speech and language problem. It's not that they're unable to speak. They speak just fine as long as they're not feeling super stressed and anxious. And then a separation anxiety disorder. Separation anxiety disorders are also commonly seen in young children. This is, you know, the kids that not just cry a little bit when you drop them off at preschool, but, you know, are crying for hours and having a lot of trouble separating and getting over that detachment from mom or dad. And, you know, that can go on really ebb and flow even through elementary school years. And I even have some, you know, older children who are worried about their parents and being separated from them and kind of that reassurance seeking of where are you and clinging to parents. Okay, so I try to, you know, put a few little cartoons in here in the mix. So I have these two cartoon characters, and one says, I started panicking a few minutes ago. I was like, don't panic, don't panic, don't panic. That made it worse. So I thought, don't tell yourself not to panic. Don't tell yourself not to panic. And then I thought, don't tell yourself not to tell yourself not to panic. And now I suspect I am a machine created to bring anxiety into the world. I've been thinking, don't tell her what you've been thinking. Don't. Just walk away. Don't stare at that child. Don't pat that cop gently on the face. Don't stand in the road talking to yourself. So again, people who are socially anxious are oftentimes worried about, what other people are thinking. They're saying things to themselves. We all talk to ourselves. We call this self-talk, and self-talk can be really positive. And self-talk in this, cartoon can be challenging, and you have to have the right kind of self-talk. You don't want to be telling yourself not to panic, not to panic. In panic disorder, it's actually learning to ride the wave. In anxiety in general, the more you fight it, the more likely it is to stick around, unfortunately, is what research tells us. And so we need to learn how to ride the waves of anxiety and recognize that we can ride through them, even though they seem scary. And then we feel stronger and more able to fight in the future when anxiety comes. So we don't use our avoidance and escape, which were my two tools that we talked about originally. We learned to have some extra tools in our tool belt where we don't use escape and avoidance nearly as much instead, because those are things that help anxiety stay alive and well in our lives. Instead, we try to come up with other tools in our coping belt to stay and fight, and to feel braver, and to say, okay, if I panic, I know what to do. I can engage in some of my breathing exercises. I can, I will get through it. It will end. It will be okay, as opposed to trying to condition your brain not to do this. And then obviously, of course, we have the social anxiety component of telling yourself not to do things that, then you start to worry about what other people may think about you. Now, here we have this performance anxiety piece, and the teacher has some, old-fashioned long division that's going on here on the board. And the little boy says, is there some place I can sign up for a do not call on me list? So obviously a lot of children who have learning disabilities do not want to be called on, but a lot of anxious kids do not want to be called on in class as well. And I think it's very important actually to differentiate which category your child falls in, or both. If your child has a learning disability, then, we need to work with teachers to scaffold so that they get called on where they can feel successful, so that when they get called on, they can go ahead and learn how to give an answer that will really help them. So that they can maybe have questions in advance and give that answer, so that they will be confident of, the correctness of their response, versus kids who, who are just anxious and already know the answer. We need to build their confidence and help them to learn to trust themselves more and more in that situation. So on that note, I'm going to end us with a break. I've run us a couple minutes into our break time. So we'll take about 15 minutes and go on our break. And I will be looking for questions during the break and get back with you with some answers. Thank you so much.
I just want to share the results. We had our opening poll at the beginning of the thing. We're trying to make this a little bit of an interaction opportunity for those of you who've joined us. So I'm going to share and see our getting to know you poll. And we'll see, we've got a lot of parents here. We've got a lot of people with 2 to 3 children, and mostly elementary and teenage, that older elementary age group is the predominant group of families that we have represented here. So that's just kind of an interesting thing. I am going to set another poll for during the break, so that just a little bit of see how well you remember what Dr. Beard had said in the first half. And then that'll be running during the break time. And it is now 10:53. We promised you 15 minutes of break. So also, if you, I put in the, I'm going to repost the link in the chat. The chat, those of you who are attendees cannot actually type things into the chat, but you should be able to see something pop up in your chat window. That is another resend of the link to the PowerPoint slides if you want to follow along with the second half and didn't get it ahead of time. One of the questions hasn't been covered yet. Oh, there was one question that hasn't been covered yet that's on the poll. So I guess take your best guess, and we'll see how well we understand when Dr. Beard comes back and gives that explanation.
All right, we are back from our break. We would think that we're all ready to go. So we are back with our break, and I'm going to run through a couple of slides quickly. so that I make sure that we can get through everything before we finish. And there were a couple of questions, and so I will go ahead and respond to those now. And then, as Mary North indicated at the beginning of the presentation, I will be available afterwards for a little bit of time to respond to some questions over the messaging system. And so not to worry that I will have time to look at those. If we don't have time to discuss them at the end, I will try to respond to them after the presentation is over. So one question, which is a very real question and one that I've had to deal with my own children, is, when will this pandemic end? And lots of children would like to know, what's the light at the end of the tunnel? And unfortunately, we don't know. And I think you have to tell children we don't know. But this is what we do know, reiterating how you care about them, reiterating what is under their control, reiterating the things that haven't changed. But being honest, because unfortunately we just don't know. Obviously you can talk about the doctors are working hard to come up with medicines, the vaccines, to try to help. But again, we don't even know how, long those will work or the viability. So you don't want to go into lots of details with children. You want to kind of keep it brief. But I think a simple, we don't know, we hope, not that much longer, but we're not sure. And we're just going to keep doing the best that we can and just reminding them, like I said, of what is stable in their life. In terms of regressions, there was a question about what do we do with teenagers and regressions. So for example, a teenager needs to sleep on the couch instead of sleeping in their room, and that they're feeling much more comfortable there. And, so we're going to talk a little bit about kind of soothing spaces a little while later. I definitely feel like talking with your kids, having open dialogue with them, what is it about sleeping in the living room, on the couch that makes you feel more comfortable? And it may be that clinging to parents, it may be just feeling like you're closer to them, that they're more available if you need something. And what I would say is, I'm less concerned about during the pandemic, but you might also try to mix it up. So maybe they sleep in the den one night and they sleep in, in a sibling's room a different night, or they sleep, somewhere. So it's not every day that's the same thing. Anxiety, the more of a ritual it becomes, the harder it is to break. Or even having the child go and lie down in their room for 10 or 5, 10, 15, kind of building up minutes. They don't have to sleep in there, but they're just going to lie in there in the dark and be by themselves in their room and tolerate their room. All of those kinds of behaviors help children to then be able to make that transition, and teenagers even back to their bedrooms. But if there's something, certainly if they feel unsafe, it's interesting. I've even had some teenagers who have felt unsafe about burglars, for example, breaking in. And so, we have my list of what's normal anxiety. So obviously, toddlers have fears of strangers and getting hurt and toileting accidents, worrying that they'll have an accident and that will be embarrassing to them. Preschoolers, animals like dogs are going to bite me. The dark is a huge one, and monsters, being left alone or separated from the parent is very common. When we go into early childhood, we have continued fears about animals. Young kids still worry about animals. Thunderstorms begin to creep in, going to school, people dying, end of life sorts of issues, whether or not they're safe. So the burglars start to kind of come onto the scene at early elementary school, but then burglar issues remain, even in some of my teenagers. And so part of learning how to cope, and even talking with your teenager about sleeping, on the couch, is what is it that they're afraid of? What is it doing? And if it tends to be some sort of anxiety root, it's kind of a funny jingle, but another psychologist who works with kids came up with this jingle for younger kids, and it goes, feeling scared or nervous, want to run away, I can use my coping plan, and then I'll say, hooray. So, instead of escaping and avoiding, we're going to come up with a coping plan and face your fears. So, for my kids, for example, who were worried about burglars, even my teenagers, now I wouldn't do this for my elementary school kids, but again, these are people who are older, but they still had this persistent fear. So sometimes our fears last longer than they're developmentally like normal anxiety appropriate, which means it's tending to go into something that we want to treat. So I had one kid, she was like 17, and, we decided that bug spray would be great to keep by her bed. Now, again, I'm not going to give a 7-year-old bug spray, but, 17 or 18-year-old, am I totally fine for them to keep a can of bug spray by their bed? And if they felt like somebody broke in to spray them with that, sure. This was not a kid that I felt like was, going to be dangerous or use it in any sort of unauthorized way. But it made them feel so much better. And, within a month, they didn't even think about the bug spray anymore. They weren't worried about burglars. They were sleeping great through the night. And not everything is that easy, but it may be that instead of having your child sleep on the couch, there are other things that you could put in place as a coping plan that might help them to feel better. But again, if it's temporary, that's fine, but try to mix it up with having some times for them to go and be in their room when it's at night, and to maybe sleep in different places, just to mix it up and make it less entrenched, kind of as something that you have to deal with later on. By late elementary school, we have fears of tests and physical illnesses. They become much more aware that you could get cancer, or something like that. And then teenagers, they still worry about getting hurt. Obviously, concussions are a huge issue that is happening in our society, and something that we're paying a lot more attention to. Social dynamics is, all the social drama is huge. And then teenagers start to be more aware of societal issues, social injustices, societal natural disasters, like hurricanes and wildfires and such, and trying to have compassion and perspective for other people. But then also becoming, afraid of that at the extreme. So what are some common fears in the pandemic? Safety of your own health and loved ones. We are seeing lots of people be concerned about their health. I talked about using hand sanitizer all the time with my own children. Increased reassurance seeking. Are you okay, Mom? Am I okay? Are we going to be okay? And answering as best as you can. We're doing the things that we can. Mom is very healthy and takes care of herself. We're not seeing grandma and grandpa because they're not so healthy, and we want to protect them as best as we can. So just trying to be honest with children. Fear about uncertainty of the future. How much longer will this last? What is life going to look like after the pandemic? And saying, we don't know. We do hope that we will get to the place where we don't have to stay 6 feet away from people and wear masks. And I think it's important also to talk about historical context here, that there were other pandemics, or epidemics, plagues and things, I hate to use the word plagues with children, but to talk about that there have been outbreaks like this historically, and that society has gone on. I think, again, that's an important context to put it in for children, that this is not the first ever outbreak, of some sort of new medical illness, and that all of humanity didn't die from that and stop going. That I think that's important for children to recognize, that this is something that we have dealt with in society many times before, especially and without nearly the modern medical day tools that we have. Fears about parents' unemployment, whether they be teenagers or younger kids. Again, kids are very aware of what's happening. And so if you're talking about your job, if they're just attuned to the fact that things are happening with your job, then children are worrying about that, and worrying about returning to school, or i.e. not returning to school. Some kids are, my socially anxious kids, or, kids are worried about the school being canceled, or that they're going to get to go back to school and then maybe they'll have to leave again, and acknowledging just the uncertainty of that, and talking to kids about, if you go back to school, this is what that's going to look like. If you don't go back to school, that's okay. This is our backup plan, and we have that covered, and telling kids what that is. So if a parent, if you don't have one, if you don't have a backup plan for your child, let's say your school is supposed to go back to in-person learning at a certain point in time, and then they're going to make a decision at the last minute that doesn't occur. I do think it's important to share with your child in advance, if something arises, I have a backup plan and I have that covered, and so you don't need to worry. How to calm the pandemonium. Take care of yourself and think about oxygen in the airplane. So I want you, so I think I'm gonna actually, I apologize for just a minute. I am going to mute the hazards of webinars. I think my daughter is doing PE upstairs. She's making a mess, or making loud noises. So hold on just one moment and I will be right back. My sincerest apologies. Okay, my apologies. My daughter has her PE class and I put her upstairs so she would be quiet, and she was hopping on one leg. All right, so we won't have jumping up and down. This is part of being resilient in a pandemic. So taking care of yourself. Think about the oxygen mask in the airplane. There's a reason that they tell you to put the oxygen mask on yourself first and then put it on your child. So you have to take care of yourself. Everything that we know about stress in the pandemic is that parents who are not taking care of themselves are more stressed, and then they're passing that stress on to their children. Even though you're trying to, if you put the oxygen mask on your child first, that's great, but then who's going to take care of your child on the airplane if there's a crisis, if you have no oxygen and you have passed out? You've not put your child in the best scenario. You need to put your mask on first so that you can then take care of your child as they're in the plane. So carve out even just a few minutes, just 5 minutes that you can go to your closet, that you can go in a bathroom and just do some deep breathing, calm yourself. If you can get out of the house and take a walk, go on a run, or do some sort of exercise is really important. If you do have another adult available, that's wonderful. If you can, get a few minutes apiece by yourself, even just going to sit outside in the backyard, exercising. You know, interestingly enough, even early on in the pandemic, they had a psychologist on CNN, and he was talking about, although you may be tempted to drink alcohol as a parent, to kind of detach a little bit, this is not what we would recommend, limiting alcohol, because alcohol unfortunately tends to especially induce depression. And so that's not going to be helpful. I would say that a lot of people are not only struggling with anxiety, but lots and lots with depression during the pandemic, especially because we don't know how much longer it's going to end. As adults, it's taxing. You know, our coping tools as adults of having a set schedule, of having the gym, of having social support, of being able to go and unwind in various contexts has in a lot of ways been removed. And so we've all had to come up with new coping tools. And so, you know, but we don't want to go into negative tools like drinking and other things that detach us from the world. Getting outside, just sitting, breathing, soaking up some vitamin D is really important as well. And so, you know, you just need to focus on taking care of yourself. And like I said, even just 5, 10, 15, 20 minutes a day can go a long way to help recharge your batteries so that you can be there to help encourage your children. How to calm during the pandemonium. Creating routines. So even though it seems like the routines are changing from one day to the next, or as soon as you get into a routine, it turns into life changes and you have to set a new one. But that's okay. Trying to have a daily schedule. Tell your children about what's going to go on today. Now, obviously, if it's a weekend and in general before the pandemonium happened and before the pandemic happened, you would just kind of hang out at your house and have a relaxed Saturday. Well, you don't need to set a schedule on Saturday. Okay, I mean, my goal isn't to overschedule people. But, you know, setting a daily routine, we're all going to get up Monday through Fridays. How do we differentiate the days so that Sunday doesn't feel like Tuesday? Monday through Friday, especially when school gets started, we're going to get up at 8 o'clock. We're going to have breakfast. We're going to do these kinds of things. After school is over, we're going to have this kind of time. You know, one of the things that I've heard from a lot of parents is that their rules about screen time have kind of gone by the wayside with the pandemic, that they used to have really set rules about screen time, you know, only being weekend time or only being evening time, and that they've really laxed up on that. And so, you know, it's reining that back in. It's trying to set some boundaries again, especially as school gets started and kids are on technology a lot. And so, you know, what are some filters that you can put on so that they're not playing their games when they should be on their Zoom call? You know, what kind of monitoring can you have? Where are you going to let them use the technology in the house? And then setting even, you know, more boundaries with technology, because they will have been on it all day to do schoolwork. Alert kids of changes. You know, again, kids need the stability and the structure. And so if you're going to set a daily change, they need to know that you're going to set a daily schedule. Let them know what the changes are. Don't just try to spring them on them. They have enough that they're kind of rolling with from one day to the next being uncertain. And then trying to keep, like I said, remnants from life before the pandemic: screen rules, bedtime routines, sleep schedules, you know, being sure that you keep as much consistent as you can from before. You know, I think that this is really important. You know, one of the things that I was able to do with my own kids during the pandemic was to help us to try to focus on other people. When the pandemic started, we had lots of Girl Scout cookies left over because my kids were Girl Scouts, and we had some extra cookies we were going to sell, and the Girl Scouts said, no more selling of cookies. So we actually took bags to about 25 of my neighbors that had a box of Girl Scout cookies and a roll of toilet paper, and we just left them on people's porches. And then, you know, for each holiday, 4th of July and Easter, and we did baked goods. We made banana bread one time. We made decorated cookies another time. And we didn't feel like we were sick. We felt like we could go and do nice things for our neighbors and be a blessing to them. And so, you know, I think it's focusing on what can you do to get outside of yourself? How can you, whether it be going to the, you know, to donate things to the food bank. I know that different organizations around town are trying to help the homeless populations. And so putting together bags of, you know, shampoos or protein bars or things like that and dropping it off. I mean, you can't go necessarily and work at the food bank right now, but there are definitely things that you can be doing to help people who are less fortunate. You know, I loved all the signs that I would see in my neighborhood that were left for, you know, the Amazon workers and other people back in March and April. Again, just trying to focus on what can we do outside of ourselves. Sometimes we just get so focused on how the world seems so different for us. But when we get outside, we have that greater sense of purpose. We feel like we're making a difference. We feel like things are a little bit more in our control. Focus on being thankful for what you do have. If your parents have a job, if your parents are, able to love and support you, focusing on the fact that you're thankful for your family, thankful for for getting to spend more time together, thankful for whatever it is in your family's life that seems to be working well, and trying to pay extra attention to the things that you still have and that are working for you. In particular, also highlight for your child each day what they do well. I think in general, parents and teachers are more prone to notice when children need redirection as opposed to when we catch them being good. But we actually want to be giving them positive feedback many times more each day, research would suggest, than giving them negative feedback. So just a gentle reminder to do that. And then one thing about the pandemic is, I will say, we tend to live in a pretty crazy world. A lot of people in general were very overscheduled before the pandemic, and it has forced us all to be at home a little bit more, forced us all to take time to be with our family more. And so trying to, instead of lament that, to enjoy it, to take the time to take a walk, to literally smell the roses, and to notice the life that you have and what's going on around you. Kind of going back to my comment earlier about the couch sleeping, creating and maintaining soothing spaces. Soothing spaces for kids are important. So maybe this fort here is a place that your children want to hang out in. And ordinarily you would allow them to have this on a Saturday and a Sunday and then dismantle it on a Monday. Some of the research is suggesting let them keep that. Now, as a parent, you have to decide where you would want this. Does it need to be this large? Probably in my house, not. I would be more inclined to give them a section of this tent and say you can put it over here. But giving them some control about and negotiating. So like, could we put it here, over here? This would be better so we could still vacuum. Could we have half of this size as opposed to another size? But trying to let them have a place that is their own, that they can go in and feel kind of safe, and let that remain until life is a little calmer. But again, obviously, if you need to vacuum, that you can put it on the bed, and that your children need to be able to kind of handle that there is some a flexibility with the system as well. Model your own soothing space for your child. So what do? I'm an exerciser, so my kids know that I like to walk or run and do things like that. And they'll ride their scooters and I'll run along with them. And they know that that's soothing for me, or to curl up and to read a book while they're doing some reading. And be creative. You can redecorate rooms, move around the furniture, add some paint. My kids, we usually take a vacation on spring break to go somewhere, and we had planned that, and we changed our vacation to flying to driving, and then we changed our vacation from driving one place to driving to another place, and then we ended up canceling it because by the time we were actually going to leave, the pandemic was in full swing. And so we stayed home and just, enjoyed our home and rode lots of scooters and things like that together. And then we were supposed to go on a trip for my parents' 50th wedding anniversary this summer, and it was a really big deal, and we didn't get to go on that either. And then our beach house that we were going to go stay in on the Texas coast had a different hurricane hit, and so we weren't going to go there either. And so I felt like, wow, my children have to keep being resilient. So we ended up painting their bedrooms. That was what we did instead of going on a vacation. And so again, I think as parents, we have to be creative. How can we still try to make things meaningful and special for our kids in our own way? That will help them. What are other things that we can do? Schedule social interactions. Lots of people have had drive-by birthday parties, have gone and sat in the car and had other kids, roll down the window and have a distance from them. We went and dropped off a little gift for some of my kids' friends the other day, and they came to the window and waved at us, and we waved at them, and, smiled for a few minutes. We've had FaceTime play dates. What are the things that you can do, whether they be in person at a distance or, online, to at least let your kids have some time? I love this one, drawing with chalk in a driveway. Maybe one person could be at the top of their driveway and the other person could be at the bottom. But you're at least getting to be together. You can have, a lot of people have socially distant picnics. They'd sit on one side of the yard and another family had sat on another side of the yard. And so you're at least able to have some social interactions with other people and build that time for your kids. Limit screen time and foster hobbies. So, I've mentioned that before. What can you do instead of screen time? Increase reading time. Some kids may not like to read, so having lots of arts and crafts. I bought more science kits than I know what to do with over the pandemic to try to give my kids things to stay entertained with. Purchasing school workbooks to do, again, and This was something I found myself. Everybody's school is different. Some kids had printed work already versus other kids had a lot of work online. For my elementary school daughter, I ended up asking her teachers to send me PDFs of all of her work and printing it up so that she had to spend less screen time. I just thought that that worked better for her, and then she didn't have to also write it on the screen. For handwriting, some kids really do struggle with using that pen, especially in elementary school, and writing on their tablet or something. And so definitely I would coordinate with your teacher, especially if your child has dysgraphia or any handwriting challenge, to try to get the physical text if they're not good typers yet, to get the physical handwriting sheet instead of trying to use the Apple Pen or something on the tablet. Outdoor time, spending time, and what can you do? I got a special outdoor sprinkler for my backyard this summer for extra outdoor time. I told you we've been riding lots of scooters. My daughter caught lizards every day during the summer, and then she would go outside and feed them, and they would stay for about 24 hours, and then she had to release it and catch a new one. What are creative things that you can be doing for outside time to keep it fun and exciting at home? And then learning to practice a new skill. When we are so busy and going from one thing to the next, it may be that you really wanted to learn the guitar, your child wanted to learn that, or how to, boost a skill. You can, get a soccer ball on Amazon and practice your soccer skills in the backyard with a YouTube video. There's some things that you may be able to have time to help your child foster some skills that they hadn't had time to do before. It may be in a little bit different way than you had imagined, but still being able to move forward. This is really important. It's just making time to talk to your children. We talked at the very beginning about gamma time, you and me alone time. So this is how you just spend time with your child. And it's time that your child gets to decide what you're going to do. I joke that you have boundaries. They don't get to color your hair purple or paint your house, things like that. But it's uninterrupted time. It's time you're not going to be on your cell phone. It's time that you're going to be devoted to them. If they want to play Monopoly, or they want you to read a book, or they want you to color the coloring pages, you're just spending 10, maybe 15 minutes a couple of times a week with them, and they know that it's that alone bonding time that you guys will have. As I mentioned before, one of the questions about when will the pandemic end, you just have to be honest. If you don't know the answers, you have to tell your kids. Limit news watching. I even talked to my adults about this. I'm not a big news watcher throughout the pandemic. I'll check the news in the morning, sometimes at night, just, for like 5 or 10 minutes, see what's going on, if there are new scholarly articles or something. But during the hurricane recently, Hurricane Laura, I was looking at the weather quite a lot, and with some people that I know and friends that live, closer to the border, as well as, here in Houston, and how to prepare. And what does that do? I didn't sleep as well that night. I stayed up really late watching, the hurricane make landfall, and that evokes a certain level of stress in us. And so I have talked to many of my patients about limiting news, and there's a lot of research about that. You don't need more than 5, 10, 15 minutes in the morning, and, maybe 30 minutes at night. And all it does is really key you up and makes you feel very out of control. And so you want to have enough news to be educated, but you don't need so much that it's going to really raise your stress levels. And also for children, they don't need to be watching, the news on a regular basis either. Waiting for children to respond and ask questions. They may not have a response immediately. And so being sure that you didn't allot them 30 seconds to have the conversation, that you're going to be able to take that time and just listen to them, and instill hope for the future. As I mentioned, it's important maybe to talk to them that there have been other illnesses in the past, and we've learned how to manage them, and people have kept on living, and it will be okay. And there will be days when the pandemic will be over. We don't know how long that is, but eventually it will be over, and we will go on. And some things in life may be a little different, and some things may be the same, but we will be able to still keep going, and we're going to have wonderful and enjoyable days yet to come. Teach your children to live outside of themselves. So, we've already talked about this in my previous slide of making the donations, making cards or gifts for people, baking, asking your children, what can we do to help other people? Whether that be their friends or their teachers, how can they try to live outside of themselves and have a sense of purpose as well, in the midst of some chaos. So professional treatments for anxiety disorders. If your children, have significant anxiety, it's something that you feel like you can't manage, I have included some book references at the end that can help you to sort of figure out some tools on your own in addition to what you've learned in the presentation. But if those things don't seem to be working and your child is struggling, most therapists who treat anxiety disorders use something called cognitive behavioral therapy. So that's CBT for short. It's kind of the gold standard for managing anxiety. It deals with the cognition. How do you think? And trying to challenge your anxious thoughts, and then your behavior. So instead of using the escape and avoidance, we're going to learn how to face our fears, which is the behavioral part of therapy. There's some other therapies out there as well that we use in supplement with CBT. Acceptance and commitment therapy is helping you to envision kind of what's going on and accept instead of fighting it, and have a calmness and a peace about that. Exposure and response prevention is part of OCD therapy. So that's like exposing yourself to touching the door handle and then preventing you from washing your hands for a period of time, for example. Mindfulness is just being aware of what's going on in your mind, of being aware of what's going on around you in a non-judgmental way. And so it's more of like a reporter technique as opposed to, placing judgments. Oftentimes what will happen is we have thoughts and then we place judgments or meanings attached to them. And, one thing, when therapy alone is not producing change, then we will talk about medication with clients when, that anxiety remains really high. So typically that's something like Zoloft, which is an SSRI, and it's been long studied in working with children who have anxiety. And there's some other medications as well, but Zoloft tends to be the most studied and prescribed one for anxiety disorders. Treatments for anxiety. So we have this kind of triangle, and we have feelings and thoughts and actions. So we can interrupt the cycle at any point in time. So we can deal with the feelings part. So that can be physical feelings, like people who have panic disorder with the heart racing, the hyperventilating. So we can teach them, this will sound strange, but in therapy, people who have panic attacks, I teach them to hyperventilate on purpose and then learn how to calm down. Because, what I want them to do is to get used to what those physical sensations feel like, so they're not so scared in the moment, and then teach them coping tools to go along with that. So interrupt the feeling, the physical feeling part. I can interrupt the thought part. So when you have these messages that are going in your head, like, I can't do that, this is too hard, I might get sick, I won't ever be able to go back to school. So beginning to change that self-talk that they have in their head to be something that's more powerful and productive in a positive way for them. And then their actions. So this is the behavior piece, changing what they do, not escaping and avoiding, but learning how to have their coping plan and face their fear. And so it's helping kids to come up with a coping plan for their various worries and fears. So more treatments for anxiety. What I often joke is, if there's a bear, that comes into my office, we should be scared and run away. The problem is that your brain sometimes, when you get anxious, tells you there's a bear when it's really, like a cute little beagle, and it's not really a bear. And so we need to learn to differentiate what's really a bear and what's not. But when there's a bear, we need to have a coping plan, and we need to learn how to run away. But when there's not really a bear, when it's our anxious brain kind of getting a little bit out of control, we need to limit our escape and avoidance. We need to learn how to fight. We need to normalize some worries. It's okay to be nervous during a pandemic. We expect people to feel uncomfortable. The fact that everybody's wearing masks and using all this hand sanitizer tells you that there's something to be afraid of. We want to be cautious and careful, but we want to focus on what we can do as opposed to feeling as out of control. And exposure therapy is facing our fears. It's, learning. And when we face our fears, we have two principles. So historically, we've talked about habituation being the focus. So I'll take the example of flying. Flying is actually a very hard fear to extinguish, quite frankly, because we don't do it enough. And in order to habituate to a fear, we are supposed to, in theory, have to face it over and over again. And each time we do that, it becomes easier and easier. So another example would be raising your hand in class. If it's really hard to raise your hand in class, I will often work with kids on starting that in a class that seems the easiest, like the teacher is the nicest, the kids are the sweetest in that class. You have that class comes easiest to you as well. It's a class that you're really good at. So we'll start by asking questions in that class. And even though you feel nervous, maybe like a 6 on a scale of 1 to 10 the first day, if you ask a question every day or make a comment every day, participate every day, by the end of a week or two, that 6 will have fallen to probably like a 2 or a 3. So that's what we call habituation. You're getting used to it. However, we've also found that some people don't actually habituate very well to some of their stress. It remains pretty high, but we have found, and anxiety researchers will joke, anxiety actually doesn't kill you. it tells you that it will, it encourages this huge panic, but anxiety doesn't harm people. It doesn't have any power. It just makes you afraid and paralyzes you. And so sometimes we just need to build up our muscles to learn how to tolerate feeling distressed or feeling anxious, and knowing that it doesn't actually, produce any sort of long-standing problems once we learn to kind of ride the wave, once we learn how to work our way through it, as opposed to running away. When we run away, we never learn that we're capable of facing our fears. I didn't put it in here, but one of my favorite quotations about anxiety, or it's a mathematical formula by this lady named Dr. Tamar Chansky, and it's one of the books, I believe, at the end. And it's a book about anxiety and as a parent, how to help your child. And so she talks about anxiety equals an overestimation of threat plus an underestimation of your ability to cope. So oftentimes we think that the situation will be way worse than it is, or our kids think it will be way worse than it is. And we think that we're not nearly capable enough to handle the situation. And so, we can boost your confidence, and then but you never learn these things if you don't face the fear. If you just run away and go home, then you don't learn that you actually could cope with it, and it wasn't nearly as bad as you thought, which is what most people will say. What we know about, there's something called anticipatory anxiety. Anticipatory anxiety is the anxiety before we ever do the thing we're afraid of. That's almost always worse than actually doing it. All right, so the worry hill model is by a lady named Dr. Oreen Wagner, and she's another anxiety disorder therapist, and she talks about riding the worry hill, and it's this process of habituation. You start off riding little bitty hills. You don't, ride Mount Everest to start with. Not that you can technically, bike ride Mount Everest, but nonetheless, a very high mountain. You're going to start off with little hills and build up your muscles and your legs and your strength and your stamina to do that. So that's where it goes back to that class, the easiest class with the warmest, sweetest teacher and the nice kids in the class. That's where you're going to start asking questions. That's where you're going to start participating. And that would be true for Zoom. That if you're trying to help your kid, be sure that they're participating on the Zoom calls. Where are you going to help them? You can structure that with which class would be easiest. Which peers do you feel the most comfortable with? Which class, and you can make suggestions. Hey, you're really great at social studies. I think that might be a good place to start. And then ask them, what's the teacher like in social studies? So they could be really great at social studies, but then if the teacher is, a little strict, then they may not feel as comfortable. And so you might want to go to their next kind of strongest subject and face those fears. And then as they get comfortable with that, then you can face another class, or face a different, a class where they're less confident, or a teacher that seems a little bit scarier to them. So, this is, again, another fear letter. This one happens to be for perfectionism and making mistakes. So what are ways to make mistakes on purpose? So this is more my general anxiety disorder. So typically you'll throw out some ideas. What if you did this? What if you did that? How hard would that be for you on a scale of 1 to 10? And then, you will have kids start with smaller challenges at first and then go on up the scale. And it's interesting, the research recently is coming out that we historically have always gone from kind of low level things gradually up to high level. But what research is suggesting now is that we may want to start off with low level things, and we may want to just kind of randomly intersperse high and low level exposures as we go through the process of treatment for anxiety. But definitely, approaching it in a structured way of, these are the tasks that we're going to work on this week, and then learn how to tolerate the distress about that, or learn how to watch your fear, lessen in response to it. Other treatments, I gave my coping plan treatment with my little jingle, feeling scared or nervous, want to run away. I can use my coping plan and then I'll say hooray. So it's the what ifs. Okay, so what if a burglar comes in the night? What are you going to do about that? Because anxiety says, oh, a burglar might come in the night, and you freeze. As opposed to asking your kids, okay, so what? So if a burglar comes, how can you be prepared? And so it's teaching your children coping ones. So what if your teacher calls on you? Maybe you can write some things down that you want to say in the class. Maybe you can email your teacher to get a question in advance. How are you going to help your kid to have a coping plan to be successful? Changing that negative self-talk, I can't do it, it's too hard, I'll be embarrassed, it will be a disaster. Taking that, catching the thought, and then helping them to say, it may be hard, but I can do that. Carol Dweck has talked a lot about a growth mindset. It's been very popular in the last few years, and it's that can-do attitude learning, that you need to practice, that most of us to learn a skill is hard work, and that we want to be focusing on growing and expanding as opposed to that perfection and expecting instant results, and changing our self-talk so that we allow ourselves to make those mistakes and to learn along the way, and that that's okay. A decision-making jar. I find some kids get really paralyzed by making decisions. It's very hard for them. They don't know where to start. I have 5 things to do today. And they could spend 45 minutes wasting time, choosing which one is first. Some kids have a structured schedule for their school, like let's say for Zoom learning. Other kids just have a packet for the week, and they may have a few classes they have to check in on, but they have a lot of unstructured time. So a decision-making jar is nothing fancy. You can take a cup or a bowl or anything in your home, and then I tell people, write down all the things you have to do, or if it's already on a sheet, you can cut it into strips of paper. I give a 5-minute limit. There's nothing magical about 5 minutes. You can make it 2 or 3 minutes. I wouldn't make it longer than 5 just because it wastes time. But you cut the tasks that you have to do into strips of paper if you haven't made a decision in 5 minutes, and then you'll just draw one. And then you go, when you finish that task, then you're going to go to the next task. And so you don't waste that time with decision making, eating up all of your time to do the work. Rewards, I get a lot of comments from parents about, well, should I reward my children? Isn't that like bribing them? And I don't know that that's good parenting. And what I tell parents is, quite frankly, there are 2 things. Number 1, children do not have fully developed frontal lobes. So your frontal lobe is the front part of your brain, and it handles planning and forethought, and what we call executive functioning is housed there. So no one's frontal lobe finishes developing until they're about 25. So as adults, we have, fully functioning frontal lobes. And we have all kinds of incentives and punishments really built into our lives for following the rules and doing what we're supposed to do. You get money to go to your job. You have social consequences if things do not, if you do not keep up with your responsibilities. If you don't pay your bills, people turn off your electricity. You get hit with extra fees. Like, there are lots of consequences and incentives for our behavior as adults. But really, in a lot of ways, we think children should just magically get up and do things because we told them to, but they don't even have frontal lobe, fully functioning frontal lobes, which is what helps us to plan and organize and recognize sort of the long-term gain of this. And so, especially when things are hard, that sweet little boy who, was having a meltdown on, Apple News that I started with today. As his mom, I would definitely sit down and be like, hey buddy, I'm going to talk to your teacher. We're going to figure out what we can do to try to make this better for you. But I realize this is super hard. And so, what can we do to work together to help you feel like powering through this 30 minutes of whatever class it was that was making him so frustrated? Is like, what's the light at the end of the tunnel for you? And so maybe that's having some extra time, doing something with mom and dad. Maybe that's that he gets to, stay up 10 minutes later. Maybe that's that he gets to decide dinner once a week, what he wants to eat. And the family has to eat it. I don't know, but this is where you have to get creative and try to brainstorm. And so to help your child to feel like there's a reward, there's something worth powering through. Anxiety is like a balance scale. If you have the anxiety of doing something over here and you don't put anything on the other side of the scale, anxiety will win every time. And so that's where the reward comes into play, because the child is thinking about, okay, what's the risk benefit for me? It's worth it for me to power through if I can see this light at the end of the tunnel. Modeling behavior, again, showing kids how we cope with things, helping them to do some deep breathing, helping them to do calm and relaxation exercises, having worry time. So worry time is where we worry on purpose, and so it's setting some kind of boundary. So at 5 o'clock, we're going to think about all of our worries, and we're going to think about them from 5 to 5:05, but we can't think about anything else, like no fun stuff, nothing about our day. We can only talk about worries, but it's a way to kind of de-stress. So, I think about, we're like vessels. We only hold so much, like a water bottle, and we have to empty ourselves out, and so the worry time is a way to empty out some of the worries and sadly make room for, some more tomorrow. But it's a way to get that out. And so some people need worry time every day. Some people need worry time once a week. But it's another tool, and you can do that with your child. They can do it on their own. They can write it down. They can do something physical. I often encourage physical, like go and kick the volleyball and talk about things that worry, kick the soccer ball or bump the volleyball, or, walk around the backyard and stomp around and think about that. You can also do that for frustration. You can have frustration or anger kind of time. Anger is a normal emotion. It's just what we deal with it that matters. So you can stomp around the backyard. You can kick your soccer ball and be frustrated. And it's good to vent that. And that will then reduce kind of irritability or anger outbursts if you're having that time where it's channeled in a productive way. Breaking tasks down into pieces, that's really important. A lot of kids get overwhelmed from an anxiety standpoint, and this is part of the decision-making piece. They just don't know where to start. And so, again, your brain is fully functioning. A teacher may give an assignment and think that your child can break it down, but they may need help to break tasks down into smaller pieces, and that's okay. And so you helping them to do that so that it seems more manageable, and then, to take it one piece at a time. So relaxation and mindfulness. Relaxation is deep breathing. And you can go through, obviously the beautiful thing now is we have technology. There are many apps. I have clients who use the Calm app and other sorts of things, Headspace, to do their relaxation exercises, just focusing on your breathing. Everybody's different. Some people find that the breathing where you count and hold for a certain number of seconds and hold out is very relaxing. Other people seem to find that very anxiety provoking because they are trying to regulate their breathing in a way that seems counterproductive. Oftentimes when I teach relaxation and deep breathing, I model, counting, just how to do the breathing where you come in. It should be diaphragmatic breathing, kind of like if you've ever taken choir. It's down below the belly button. I have people actually put their hand on their lower stomach below the belly button. And I say, take a deep breath in. And when you breathe in, that lower part of your stomach, your belly, below your belly button should pooch out. And then when you breathe out, that should come in towards your spine. And then when you keep your hand on your stomach, it kind of helps you to learn to regulate that process. And they shouldn't be like pants, like, it should be nice, slow, controlled, deep breaths. And, whether you hold that for 2 seconds or 5 seconds, I think really depends on the person. It's just kind of coming up with your own rhythm. And then focusing on, saying like in and out, or 1 and 2 as you breathe in and you breathe out, feeling the air in your nostrils. It does work better if you breathe in through your nose and out through your mouth. But it's just trying to get in the place where you take those deep breaths. And then once you teach that skill, then you can pair that with 2 other things, which is picturing yourself in a calm place like this beautiful beach here, and you walk through all your senses. What are you hearing? What are you seeing? What are you tasting and smelling and feeling? Like, maybe emotionally, but also physically, the sand under your toes, the warmth of the sun, the air, of the mist of the ocean coming up and touching your skin. So really trying to envision yourself in that place, tensing your muscles. Usually you'll start at your toes and kind of crinkle them up and go up to each muscle group and tense them and count to 5. And then you'll slowly relax them. And then you'll do a kind of segment of just the deep breathing. And so I always try to teach the deep breathing first to try to calm you. And then you'll go all the way up parts of your body. You don't have to do them in order. Historically, it's taught toes to your kind of face and crinkling up your face. But you can do it in different order. You can also focus on certain areas of your body. I personally tend to store more of my stress in my neck and shoulders. So I might just tense my neck and shoulders one or 2 times and then relax them without going through my whole body. So mindfulness is also attending to your 5 senses, noticing what's around you, noticing just a bookcase and being mindful of that and commenting on all the details about it and being aware in a way. How often do you, for example, look at my water bottle and all the different things that it says on it and the way that the curvature is? And it's a way to be really engrossed in something in your environment that takes away your brain from focusing on the anxiety. And then focusing on the here and now. Years ago, I had a very sweet client that said that they had learned from another therapist that when they started to think about 5 or 10 years in advance, they would just hold on to something. And it would remind them they needed to ground themselves into the here and now. And that they needed to get back to this moment and what is happening right now. And asking yourself, how does this affect me right now? Oftentimes when we're anxious, we live in the future. We live in what will life be like next week or next year or 5 years from now. And getting back to what's right now. What do I need to worry about right now? What are my responsibilities today? What do I need to do this hour? And grounding yourself and taking a couple of minutes just to calm yourself down. One of the things that we use in cognitive behavioral therapy is something called a thought log. So we're going to keep track. It's part of how we change that thinking piece of your brain. So you have a date, you write down what's happening. So I am sitting on a Zoom call for social studies and my stomach starts hurting and I'm feeling uncomfortable and I want to run away. And how scared am I on a scale of 1 to 10? And what does my body feel like? Like I said, that stomach ache, heart pounding, maybe shaking, even if you're feeling super nervous. What am I thinking? So maybe in social studies, you're going to think you're going to fail this test. You're doing a review and you think that you'll have to repeat the second grade and a disaster or catastrophe will be happening. And then what do I do? So what does the child do? Do they go to the bathroom and escape? Do they stay and fight? Do they engage in what we call positive self-talk and say, wait a minute, you know, I can do this. It's going to be okay. I can stick it out, or I can go talk to my teacher. I can tell my parents about my stomach ache. You know, if you have questions, you know, I can ask about a review sheet. I can ask questions about what's on the test. I can ask my mom to help me study for it. So how are you going to try to find yourself some tools? So here are some more tips for parents. Time well spent. So we've already talked about you and me alone time, which is just the YAMA time from before. It's not so much of an issue as it was in the past, cutting back on overscheduling. But I think, you know, this is one of the lessons that we learned from the pandemic is how to simplify our lives, quite frankly. I hope that in some ways the pandemic will readjust us to the importance of family time, to the importance of having a little bit more downtime than we have been used to for a very long time. And then maintaining the routines that we have. You know, I've already talked about the psychopharmacology a bit. There's something called the CAM study. It's a longitudinal study that has been funded by the National Institutes of Mental Health. It's been running for, I think, nearly 2 decades now, following children who have been on Zoloft and who have had anxiety treatment, comparing cognitive behavioral therapy to Zoloft alone to the combination thereof. And the more severe the anxiety, the more likely it is that you would need both kinds of treatment for an anxiety disorder. But a lot of my children don't stay on anxiety medication for too long. Some of them, you know, usually about a year or so, versus, you know, more adults will take anxiety medication for a longer period of time, has just been my experience. So I made a disclaimer. Obviously, this is not intended to take the place of professional help, but you know, if you need assistance, certainly the Family Support Office at NIHouse is available. The anxiety disorders. So I'm going to look here. So the Anxiety and Depression Association of America, the ADAA.org website, they have a provider link that's there. The International Obsessive Compulsive Foundation Disorder, which is the organization right below that foundation, both of them have treatment provider lists for anxiety therapists. So those are great places to start with people who actually really are trained in dealing with anxiety. So that also will provide you with some resources. I have the book that I mentioned, my anxiety equation. So anxiety equals, you know, an overestimation of threat plus an underestimation of your ability to cope, was from that Freeing Your Child from Anxiety book by Tamar Chansky. And so that's a great, wonderful book for parents to read. It's written for parents about anxiety and how to help your children with anxiety and stress. I have some other websites that are listed there. And then I did want to bring your attention to the second book, Something Bad Happened, A Kid's Guide to Coping with Events in the News. So this is a new book. Dr. Dawn Huebner has written a number of anxiety workbooks for kids that help them, that parents can use, that are purchased through the American Psychological Association. And she's written this one recently in relation to the pandemic and just other, you know, stressful news kinds of related events. So that's another resource for you to get as a parent. It gives you a way to talk about things with, and they're usually written for younger kids, I would say elementary aged kids, kindergarten through elementary aged kids. The book at the very bottom, My Anxious Mind, is a wonderful book for teenagers with anxiety that walks them through a lot of cognitive behavioral tools to try to help them to learn to manage as well. And then I just have more references from the presentation. So I have really enjoyed this, and my contact information is there as well. So I have really enjoyed getting to talk to you guys today. I so appreciate your time, and I will be fielding some questions remotely. So I'll just type my answers after the presentation is over. Thank you so much for coming and being with us today and listening.
Thank you, Michelle. I thought maybe we'd both be on the screen, but thank you, Michelle. It's a big help to be able to understand and manage some of the things we're feeling at this unprecedented time. And it's good to have a little objectivity about how to address this stress. We look forward to seeing you as all the attendees at our September and October webinars. And thank you very much. Now, I think we do have some questions here, and I'm not actually sure how we address those. So maybe my fellow webinar gurus can help us with that. Is it on screen?
Yeah, Dr. Beard, we're still recording. So if you want to go ahead and answer these out loud, that will get to the recording that will be available to the people who attended and the people who signed up but missed it. So that might actually be a good way to handle it. So.
And with that, if you want to post them on the screen and then I can look at them, that would be lovely. And I will try to address them that way.
Okay. If you just go to the Q&A, do you have a Q&A on your toolbar at the bottom there? That way we're not doing a screen share that's taking up bandwidth if we don't have to.
Yes.
Okay, there you go. So the open questions, those are the 3 that people came in with during the second half. So.
All right. So one, I have an anonymous. It looks like, what are your thoughts about using CBD, which is a cannabis-based treatment for anxiety? And what I will say is I actually attended some seminars recently through the International Obsessive Compulsive Disorder Foundation related to cannabis treatment. And I will say that they're still doing a lot of research, but some of the preliminary research does indicate that it actually can exacerbate anxiety. And so that's definitely not a recommended treatment at this time based on the medical research. I mean, there's certainly, I have had patients who have told me various cannabis-based interventions they found to be helpful, but the research tends to suggest that it is something that produces anxiety over the long term. And I certainly suspect that it also qualitatively has exacerbated the anxiety for a number of my clients. So that's not, at least at this point in time, something that is recommended as a treatment for anxiety. So, in terms of, another person asked about wine, I certainly am not trying to say that you shouldn't have any sort of alcohol. I mean, I think the general recommendation is to limit your alcohol intake. If you historically have been drinking 1 to 2 glasses of wine even before the pandemic, then, obviously that's just your lifestyle, and just continuing to monitor that 1 to 2 glasses doesn't turn into 3 or 4, I think is important. We all have different coping tools. So I think that, you just want to keep that in moderation and be sure that it doesn't grow into something that becomes more of a numbing behavior or impairs your functioning. So if it makes it harder for you to get up in the morning and deal with your children or something like that, then, that would be, my recommendation. If you have any concerns about, how much you're drinking, I certainly encourage you to talk to just like your general practitioner about that. But I mean, I think there are a lot of people in the world who historically, especially in European countries, drink 1 to 2 glasses of wine a night, throughout their life. And it just, I think watching that as a coping tool, and if that's something that continues to increase, would be the more concerning piece to me. And then, I got a question from a school leader saying, how do you transition students back to school, supporting them and keeping them safe, having high expectations for their learning, but not overwhelming them? I think one of the biggest questions that I have, and I've actually spoken with Mary and Suze about this, and am very curious as well as concerned as to how we deal with the gaps that I anticipate children are going to have from the pandemic. Gaps from the spring semester, everybody was doing the best that they could. Administrators, teachers were working overtime, having to go out and buy equipment personally for their homes. I'm so in awe of what the teachers had to manage, and administrators in over and then devoting all of their summer, a lot of their summer time to trying to plan for curriculum for this year. And I think it's a delicate balance. I personally will say, as a child psychologist, that my own daughter is up on her Zoom, and she's not a kid who has meltdowns over Zoom. Thankfully, she tends to kind of roll with most things in life pretty well, by some miracle, but she does. But, I personally, as a child psychologist and as a parent, have concerns. She's a 4th grader, and she is spending 8 hours a day on Zoom. And that's, to me, crazy. I mean, you know, I'm kind of like, we need to do reading, we need to do math, we need to do science, you know, history, English, your core subjects. You know, well, I had to interrupt my program because she's doing PE, and I'm all for health. You know, I'm all for exercise. I think exercise is a wonderful component, but I think it would be great if those things were just broadcast. If you get into a virtual, you know, learning environment, trying to limit what kids are actually responsible for. So offering supplemental activities, but not requiring them, so that if they do have Zoom fatigue, that they're not having to spend more than the required hours a day on that. But in terms of going back to school in person, you know, I think that that's a concern as well, assessing kids for learning gaps. You know, and then if we have to take another break from school later on, you know, how are we going to address this? And part of my concern that I was sharing with the Family Support Office at NIHouse is, you know, how are we going to differentiate children who have true learning disabilities from children who have curriculum-based gaps because of COVID? And I think that's going to require a lot more sophistication on the standpoint of evaluators and looking at historical data and trying to garner a greater picture, kind of a wider lens of kids, because the last thing that we want is for kids who have, for example, dyslexia, that we know is so important, to intervene early on, to get labeled as just having gaps from the pandemic and then not be assessed and not be receiving the services that they need. So, you know, I think part of it is going to be doing some sort of assessment for those kids, figuring out who missed things, you know, and how to fill in some of those foundational gaps. Because as we know, you know, whether you're in elementary school or in high school learning, you know, Algebra 1, Algebra 1 goes into Algebra 2, you know, a couple of years later. And so you need those foundational skills. And so we as you know, people in the education field are really tasked with a very cumbersome job of trying to evaluate that, because that's going to produce stress and anxiety, you know, if we're building upon concepts that we think kids know and they don't. You know, so trying to figure out what the gaps are from last year, from distance learning, and from this year, whatever distance learning that we have to meet kids where they are, to fill in those foundational gaps, is going to be really important. You know, and I think helping them to know what to expect, you know, as much information as you can communicate to families about, this is what our school is going to look like. This is what the classroom is going to look like. If you can send kids pictures, if you can show them, like, this is what your classroom will look like. This is how far you'll have to be from, you know, people. This is how the cafeteria is going to work. And again, you know, I don't want it to be so cumbersome that it's overwhelming to kids, but giving them kind of a snapshot of what to expect. You know, I know that some schools actually even have done a run through where they've had kids come for like an hour and walk through the school and show them, this is how you're going to do the cafeteria, and this is how we're going to sit in our room, and this is what it's going to look like. And so they know what to expect, kind of like Meet the Teacher, but it's like Meet Your School during COVID. You know, what is that going to look like for you? You know, I loved one of my daughter's school's recommendations of have your child wear a mask at home, you know, so that they get used to that, and just what it's like to wear a mask and to have to deal with that. And if they have adverse reactions, it's hard to breathe, you know, that they struggle with, you know, feeling nauseous, that they can process all of that with their parents. And so to me, it's just providing kids with as much information as you can to help them know what to expect. So I think those are the questions, unless any more have come in that I saw on the screen. So I appreciate so much. I will be available for another, you know, 15 minutes or so to answer questions, 15 or 20 minutes. And if you have other questions, I so appreciate it, and have really enjoyed speaking with you all today. Thank you so much.
Thank you. Thank you so much.
Okay, bye-bye.
Bye.